The incidence of thromboembolic complications after major orthopaedic surgery has been described over the last 30 to 40 years. And in terms of understanding the true frequency of disease, both in terms of asymptomatic thrombosis, that's the blood clots that we screen using methods such as venography, symptomatic thrombosis, those are the clinical events that will be diagnosed by a doctor examining a patient, or fatal events such as pulmonary embolism. In many ways we're dependent upon the era before we started worrying about blood clots, where we had access to autopsy data or we had access to clinical data where patients were not receiving antithrombotic drugs. Those historic series suggest anything up to 50% of patients may develop a silent blood clot in the leg after orthopaedic surgery if they're not given antithrombotic measures in the perioperative period, and anything up to 1 to 2% might have died of a fatal blood clot in the postoperative period without preventative measures. Modern surgical practice has changed, and many say that as a result of that the frequency of blood clots has also reduced. But to counter that, of course, we are operating on older patients, and age is an important risk factor for the development of postoperative thrombosis, and we're doing more extensive operations on these patients, again heightening the risk for thrombosis. So in modern surgical practice, without the benefits of thromboprophylaxis, anything between 2 and 4% of patients would probably develop a symptomatic blood clot, and anything between 0.5% and 1% of patients might die of that blood clot if we didn't take measures to prevent it in the postoperative period.